Welcome to Part 3 of our Home Health Compliance Tips series. Today, we're going to discuss denial prevention by defining confined to home and meeting documentation requirements. A patient's residence is wherever they make their home. This could be their own dwelling, an apartment, a relative's home, a home for the aged, or some other type of institution. However, an institution may not be considered a patient's residence if it meets the requirements of Section 1861E1 or 1819A1 of the Social Security Act, such as a hospital, a skilled nursing facility, or most nursing facilities under Medicaid. A patient may also have more than one home. Under a Medicare Home Health Plan of Care, living in more than one place of residence during an episode of Medicare-covered home health services will not disqualify a patient's homebound status for purposes of their eligibility. For example, a person might reside in a principal home, as well as a second vacation home, a mobile home, or the home of a caretaker relative. The fact that the patient lives in more than one home and, as a result, must travel from one to the other is not in itself an indication that the patient is not homebound. However, the requirements of homebound must be met at each location, meaning that the patient must meet both criteria of Section 30.1.1 listed in Chapter 7 of the Medicare Benefit Policy Manual, which we'll cover here in a moment. For a patient to be eligible to receive covered home health services under both Part A and Part B, the law requires that a physician must certify in all cases that the patient is confined to their home. For the purposes of the statute, an individual is considered homebound if they meet the two criteria of Section 30.1.1. This first criterion is that the patient must either need the aid of supportive devices, special transportation, or the assistance of another person to leave their residence, or they have a condition which makes leaving their home medically contraindicated. Once this first criterion is met, then the patient must also meet the two requirements of Criterion 2, and the physician must review and document these additional requirements. The second criterion is that there is a normal inability to leave the home, and leaving the home must require a considerable and taxing effort. In determining whether a patient meets Criterion 2 of the homebound definition, the provider will take into account the illness or injury for which the patient met Criterion 1 and consider that illness or injury in the context of the patient's overall condition. It's not required to include standardized phrases reflecting the patient's condition in the patient's chart, nor are such phrases sufficient by themselves to demonstrate that Criterion 2 has been met. For example, longitudinal clinical information about the patient's health is typically needed to demonstrate a normal inability to leave the home and that leaving the home requires a considerable and taxing effort. This type of clinical information about the patient's overall health status might include the patient's diagnosis, the duration of their condition, clinical course, prognosis, the nature and extent of functional limitations, other therapeutic interventions and results, and other factors. If the patient does leave home, they may still be considered homebound if these absences are infrequent for periods of relatively short duration or are attributable to the need to receive healthcare treatment. Some examples of absences that are attributable to the need to receive healthcare treatment include attendance at adult day centers to receive medical care, ongoing receipt of outpatient kidney dialysis, or the receipt of outpatient chemotherapy or radiation therapy. Occasional absences from the home for non-medical purposes, such as trips to the barber, attending a family reunion, or other unique events like a graduation, will not threaten a patient's homebound status as long as these activities are infrequent or are relatively short in duration. An aged person who does not often travel from home because of feebleness and insecurity brought on by their advanced age would not be considered confined to the home for the purposes of receiving home health services. This, of course, is based on their not meeting the two criteria of homebound that we've discussed. If a question is raised as to whether a patient is confined to their home, the HHA will be asked to furnish the Medicare contractor with information necessary to establish that the patient is indeed homebound. You can learn more about documentation and coding requirements through our comprehensive clinical documentation improvement course. You might also consider obtaining your Certified Medical Documentation Professional or CMDP credential through this program. Contact our office for more information, and I hope you enjoyed this coding and documentation tip.